Okay, so let's talk about the second function of the spinal cord, which is autonomic reflexes. Remember, the gray matter of our spinal cord is going to be a processing center. So we're going to be processing information and then relaying it back to the body. This is done by the gray matter of our spinal cord, and we commonly call this reflexes. So if you look at this, it says the spinal cord serves as an integration center for our spinal reflexes. A reflex is a fast, predictable, and automatic response to some kind of change in our environment so that we can maintain homeostasis. You don't want to get injured, and reflexes help us avoid injury. It says reflexes help maintain homeostasis by permitting the body to make exceedingly fast adjustments. So we can stop ourselves from something like falling. We can maintain blood pressure, carbon dioxide. The reflexes that we're most probably accustomed to thinking of are the painful stimuli type reflexes, where, for example, you touch something too hot and you yank your hand away, or you step on something that hurts and you get your foot out of there. Those are painful stimuli reflexes, but these are all spinal reflexes. So let's look at our first handout on reflexes, which is going to be 13C, and we're going to discuss some of these different responses that we have that are controlled by the spinal cord. So here is handout 13C, and I have these broken into I think 5 different reflexes. So our first reflex is known as the stretch reflex. And so the stretch reflex, it says it's where muscles contract in response to a stretching force that's applied to them. So what's going to happen is you're going to have some kind of stretching force on the muscle. That information is going to be relayed to your spinal cord, and then your spinal cord will invoke a spinal stretch reflex to relax that muscle so it doesn't get damaged. So what we're going to do is we're going to have some kind of stretching force on the muscle. That information is going to be relayed to our spinal cord. The spinal cord will then send a motor signal back to those muscles involved to tell them to relax. This is going to prevent overstretching of our muscles. Now, a perfect example of this would be the patellar reflex. The patellar reflex is what the doctor does when he taps your knee. And so if I was in class, I always get up on the table and I kind of demonstrate this. But if you tap your knee in a specific spot, you have that kick reflex, right? That is a type of stretch reflex. What you're doing when you tap on your knee is you are causing a stretch force to be applied to the patellar tendon and to that muscle, and that's going to invoke this reflex. That information is going to zip over to the spinal cord. The spinal cord is going to process that and then cause you to have that kick. Now, you might ask, why do I kick when that happens? Well, that is a response to trying to prevent you from falling. The patellar reflex is actually a reflex that keeps you from having your legs collapse and you fall. So when there's a stretch applied to that patellar tendon, the kicking is due to the fact that we want to maintain our legs straight so that we do not fall. And so that's what's going on. Now, why do doctors perform a patellar reflex test on you? Well, if everything is functioning right and your spinal cord is normal, you should have that normal patellar reflex. What they're looking for when they tap your knee is some abnormality, some abnormal type of response. And if that occurs, then that could be an indication that there is something wrong with the central nervous system. So this is the easiest, simplest reflex. The second one on our diagram is called the Golgi tendon reflex. This makes some sense too, because you've got nerves that are embedded in your tendons, and the Golgi tendon reflex is going to prevent overstretching of those tendons. So if those tendons are being pulled too tightly, it's going to cause a reflex zips up from that tendon to your spinal cord. Your spinal cord will process that information, send a motor signal back to relax those muscles to prevent overstretching of your tendons. And so that's a pretty straightforward kind of reflex. This is happening all the time as you shift your weight back and forth and that kind of thing. Let's move on to handout 13D, and we'll go into the next type of reflex, which is called a withdrawal reflex. Your withdrawal reflex is where you're going to remove one limb from a painful stimulus. So I love this picture because they show this tack that's just ginormously huge. But let's say you step on a tack and you're going to move your leg out of the way. That is a simple withdrawal reflex. Now, the thing is withdrawal reflexes can become more sophisticated. So this next one is called a withdrawal reflex with reciprocal innervation. This is where you're going to relax one set of muscles and contract another set of muscles. All right. So if I step on this tack and I pull my quads up, so I contract my quadriceps to pull my leg up, I'm going to have reciprocal innervation to relax those hamstrings. All right. So, pretty simple, straightforward with that. Now, there is a variation of this that's on the next handout. This is handout 13E. We're just going to kill these 3 handouts all together in one video here. But the other type of withdrawal reflex is called withdrawal with a crossed extensor. And so it says we're going to withdraw one leg with the extension of the opposite leg. This only happens in the leg. Our other type of withdrawal, I'm going to put this back up here really quick. This is 13D. The reciprocal innervation can happen in our arms and our legs. So like if I contract with a reflex, my biceps, my triceps are going to relax. And so this happens in the arms and the legs. The crossed extensor reflex can only happen in your legs. So what you're going to do is when you step on something, all right, let's say you step on something that hurts, you're going to lift that leg up and you're going to kick the other leg the opposite direction. So if I step on something that hurts, I lift this leg up and then my other leg gets extended to prevent me from falling. This is why this only happens with the leg. You like my little finger person? I lift up one leg and my other leg gets extended to keep me standing up because I don't want to just fall because that could cause injury, right? So we're going to have this withdrawal with crossed extensor reflex. I'm going to pick up one leg and I'm going to put the other leg down, extend it so I can stay standing. Now, the final reflex I want to mention is called the plantar flexion reflex. And the plantar flexion reflex is going to occur when you stroke the sole of the bottom of someone's foot. So it says I stroke the lateral margin of the sole. A normal plantar flexion reflex, if the person's not aware that you're going to do this, what they'll do is they'll end up curling their toes. So their toes curl, and that's the normal. If they have something wrong with their central nervous system and you do the plantar flexion reflex and they fan their toes like in this picture, that is called the Babinski sign. And this could be due to someone having a spinal cord injury or it could be some kind of neurological disease like multiple sclerosis may cause this. So it says a fanning of the toes is normal in children. That should say in children. Is normal in... I never noticed that was wrong. All these years I've had this and I didn't realize that was a typo. Anyway, fanning of toes is normal in children 18 months or younger because they don't have the proper myelination. So if you do this with an infant, they will fan their toes. Don't worry, that's normal. But if an adult or anyone over 18 months actually fans their toes, they have some kind of problem. Multiple sclerosis is a good example of this because it destroys our myelin. So someone with multiple sclerosis, if you stroke that lateral margin of their sole, they will fan their toes. I had a student at the high school a couple years ago, and I was going over this, and he was telling me that his dad was partially paralyzed in an accident. And so after my lecture talking about this plantar flexion reflex, he went home and he actually performed this test on his dad, and he came back the next day all excited. He's like, "You won't believe it, Mr. Garhart. I did the plantar flexion reflex on my dad, and he fanned his toes." And then he, told me about his dad's accident and how he was partially paralyzed, and he still can move his feet, I guess, but he's got nerve damage and has the Babinski sign when this reflex is tested. So kind of interesting little tidbit there, but that takes care of the different functions of our spinal cord. And you need to be able to kind of tell me the differences between these different reflexes. Now we're going to talk a little bit in the next several videos about how this all happens. How does this all work? How do we send information to and from the spinal cord? How do the spinal nerves play a role in this? And how are they constructed and what's their anatomy? So that will be coming up next. All right, so we just killed 3 handouts with 1 video. Woohoo! We're cruising.